Hey, could you do Trintillex, please? Of course. Okay, so Trintillex is the brand name for a medication called Vortioxetine. And fun fact, Trintillex actually used to be called Brintillex, but the FDA changed the name to Trintillex because there's a common blood thinning medication called Brintilla, and the similarities in names led to a lot of medication dispensation errors. Just thought that was interesting for you guys to know. Okay, so let's look at the chemical structure. This is what it looks like. And this is the receptor binding profile for Trintillex. We're going to spend a lot of time here. So, interesting thing to know about Trintillex is that it is not just your typical SSRI. It is actually something called an SMS, which is a serotonin modulator and stimulator. And really what that means is that this one medication manipulates serotonin in more than one way, right? It doesn't just block serotonin reuptake, and we'll talk about that. And just so we remember, right, like what these numbers mean, you see the number that says affinity. Affinity is measured inversely. So the lower the number, the higher the affinity, right? The higher the molecule binds to the receptor. So you're looking at these numbers are all low. That means it's binding very strongly. So it inhibits SERT, which is the serotonin transporter, right? It inhibits NET, which is the norepinephrine transporter, right? Thus increasing serotonin and norepinephrine in the brain. But what's going on with it's an agonist at HT1A, that's serotonin 1A receptor. Now this receptor, when it's stimulated, has an anxiolytic effect, lowers anxiety. In fact, buspirone, is an agonist at 5-HT1A. So this medication is like taking an SSRI plus buspar. The activity at HT1B modulates both serotonin and dopaminergic activity. And the one I really want to get to is 5-HT3A. Now, this is a unique serotonin receptor because one of the things that it does there, and it's an antagonist there, is that it modulates procognitive effects, which, a lot of people don't think of depression as a sort of cognitive illness, but it is. Depression kind of slows your brain down too. And serotonin receptor 7, that's going to be related more to sleep. Now, the one difficult thing about Trintillex is that it is still on patent in the United States until December of 2031. So it is a very expensive medication, so insurance can sometimes give people a hard time when trying to pay for it. But other than that, it's a really safe antidepressant, and it seems to have a lot of protective factors against side effects that typical antidepressants cause. Let me know if you have questions below.